If you were to walk into any primary care surgery or hospital staff room in the UK or the US for that matter and ask a clinician what their biggest headache is, they're likely not to say complex diagnosis. They'll say documentation. We're drowning in administrative burden. We spend 2 hours typing for every hour we spend with a patient. It's the primary driver of the burnout crisis in healthcare. And for the last 2 years, the industry has promised us a silver bullet, known as Ambient AI Scribes. These are the tools that listen to the consultation and write a note for you. The promise is that they'll give us our evenings back, saved from all that administrative burden. Well, the jury's finally returned, and we now have the first 2 rigorous randomized controlled trials, RCTs, on these tools, published in the latest edition of the New England Journal's AI edition, along with a very sharp editorial summarizing the 2 papers. We're looking at data from UW Health testing Abridge and UCLA testing Microsoft's DAX Copilot and Nabla. The results are really interesting, slightly contradictory, and vital for anyone thinking about procuring these tools. So let's dive in. So first, let's look at the ambition. The goal here is obvious: remove the keyboard from a patient encounter. But the hurdle, the central tension revealed in these papers, is the gap that exists between perceived relief and actual time saved. So let's start with the UW Health study led by Afshar and colleagues. This was a 24-week study using Abridge. It was a stepped wedge design, which is a clever way of rolling out the tech to everyone eventually while still randomizing the timing. The headline news is that broadly it worked. Clinicians used Abridge, reported significantly lower work exhaustion and improved professional fulfillment. They also saw a reduction in work outside of work, that dreaded evening administrative work, by about 30 minutes a day, though that data was a bit noisy. Crucially, adoption was high. Over 70% of the encounters used the AI, and for any financial officers listening, the billing coding compliance actually improved when people use these tools. So does that mean the case is closed? Not quite. We have to look at the second trial from UCLA led by Lukac and colleagues. They compared DAX Copilot and Nabla against a control group. Here the water gets muddier. Adoption was much lower, only about 30%. When they measured time in note, Nabla users saved about 9%, roughly a minute or so per visit, but DAX users saw no statistically significant reduction in time spent on notes compared to the control group. Now pause there. How can an AI write a note and not save you time? The UCLA team highlighted a critical technical limitation. They measured time using Epic's signal data, basically how long the note was open in the electronic healthcare record. But these AI tools often work in a separate app or window where you review and edit the text before pasting it in. Epic doesn't see that time, so we might be underestimating the workload. However, this is the pivot point. Despite the lack of massive time savings in the UCLA data, the doctors still felt better. Both DAX and Nabla users reported reduced cognitive task load and less exhaustion. This brings us to the editorial by Eileen, Kim and colleagues, which hits the nail on the head. Their title, AI Scribes are not productivity tools yet. The editorial argues that if we judge these tools solely by the stopwatch, they're currently underwhelming. Saving 2 minutes here or there isn't transformative. However, they are successful cognitive load tools. They allow the doctor to look at the patient instead of the screen. The synthesis of 3 papers tells us this. The AI is accurate, hallucinations were rare but present, requiring vigilance. It improves the quality of the note and the coding. It makes doctors feel less burnt out. But they don't yet magically result in a 30% shorter workday. So how do we bridge this gap? If you're the Chief Medical Information Officer or a digital transformation lead, what's the next move? First, I think the focus needs to shift from selling these based on time savings alone. If you promise your board that buying an AI scribe will allow you to squeeze in 2 extra patients a day, then you're likely to fail and the clinicians will revolt and become even more burnt out. The evidence simply doesn't support that yet. Instead, it should perhaps be more framed as a safety and retention play. The UW study showed improved billing accuracy. That's the financial incentive. The reduction in work exhaustion is a retention hook. Second, we need to change how we think about deploying the tools. The review and edit phase is where the time is lost. We need to integrate these tools deeply within electronic healthcare records so the workflow is seamless and not toggling between different apps and copying and pasting between different systems. And finally, the smart next step. The editorial points out that documentation is just the tip of the iceberg. The real productivity explosion will happen when AI listens to the consultation and does the downstream work. If it pens an MRI order, drafts a referral letter, and queues up the prescription. This is the agentic AI that we discussed in a previous episode, and that's where we need to push these vendors next to build on top of this core functionality. So the final verdict, these RCTs prove that ambient AI is relatively safe, effective at reducing cognitive load, and broadly welcomed by clinicians, providing that the workflow is right and that vigilance is high for the review and editing phase. It's not a magic wand for productivity, but it's a necessary foundation that other functionality can be built upon. It's time to move on from will it write the note to what else can it do. It's really exciting work, and I'm sure this is just the very beginning.